Assalamu alaikum dear students, I hope you all are doing good. Today I will discuss the viva questions for second prof students, those who are affiliated with University of the Punjab. So these days the viva questions are being asked by the students of Punjab University as there is going on viva in Punjab University. So I thought to make a video regarding the major viva questions. So I will just discuss the questions. First question is what is the definition of pharmacology? Next is what is the definition of drug? Next question is what are the four major types of receptors? First type is G protein coupled receptor, then is ligand ion channel, and then there is enzyme linked receptors, and then intracellular receptor. In case of intracellular receptors, there are two types: cytosolic receptors and nuclear receptors. Now then, the next question is classification of autonomic nervous system. Means what are the subdivisions of the autonomic? As we know, parasympathetic nervous system and sympathetic nervous system. Next is classification of the ANS drugs, like parasympathomimetics. In case of parasympathomimetics, there are two categories: direct acting parasympathomimetics and indirect acting parasympathomimetics. In case of parasympatholytics, as atropine, scopolamine, etc. In case of sympathomimetic, there are alpha agonist and beta agonist. In case of sympatholytics, beta blockers and alpha blockers. So this is the major and a surface classification of ANS drugs. Now, drugs for myasthenia gravis, the drugs those are used for the treatment of myasthenia gravis. The drugs are physostigmine, main is, then neostigmine can also be used. The next question: which drug is used for the diagnosis of myasthenia gravis? The answer is adrophonia. Okay. What is the use of pilocarpine? Pilocarpine is used for the treatment of the glaucoma. The next question is what is the selective beta 2 agonist, and the name of drug is dobutamine, and another name is butoxamine. Okay. Next question is what is the role of beta 2 receptor in aqueous humor production? So as all of you know that beta 2 receptors are present on the ciliary epithelium or ciliary muscle of eye. So when these receptors will be activated by its endogenous ligand, like for example norepinephrine, then there is activation of this beta 2 receptor. The receptor will be on, then it will be activating the adenylyl cyclase. Adenylyl cyclase then will be activating the or increasing the level of cyclic AMP. Cyclic AMP will activate protein kinase. Now this protein kinase will be going to increase the activity of carbonic anhydrase, that will increase the production of aqueous humor by increasing the production of bicarbonates, which are the major component of aqueous humor. Okay. Now the next question is cardioselective beta blockers. The cardioselective beta blockers are the atenolol, butoxolol, esmolol, celiprolol, metoprolol, etc. Next question is classification of the antihypertensive. As all of you know, ACE inhibitor, ARBs, diuretics, beta blockers, calcium channel blockers, etc. Now there was a question asked: what are the neprilysin inhibitors? So first discuss what is neprilysin. Is an enzyme that is responsible for the breakdown of certain peptides. Those are responsible for vasodilation and increases the diuresis. Like for example, ANP, atrial natriuretic peptide, and BNP, brain natriuretic. These are the peptides those are responsible for natural diuresis and vasodilation. So when this neprilysin will be inhibited, there will be increased level of these endogenously produced peptide like BNP and NP. Then there will be the natural diuresis and vasodilation. So in this case, blood pressure can be decreased and congestive heart failure can also be minimized. So this question was asked. So the next question is what are ACE inhibitors? Name of drugs, as all of you know that captopril, enalapril, etc. So the next question that was being asked was what are the major side effects of ACE inhibitors? The major side effects of inhibitors are cough, angioedema, metallic taste or change in the taste. So these are the main side effects. There are other, and the next major is acute renal failure. These are the side effects of the ACE inhibitors. And the question was linked with this question as well, that how ACE inhibitors are going to cause cough. So ACE inhibitors are going to increase the level of bradykinin, which is responsible for the cough. So the next question is what is the digoxin? Digoxin is the drug used for the treatment of the congestive heart failure. And what is the mechanism of action of digoxin? Digoxin is going to block sodium potassium ATPase and used for the treatment of heart failure by increasing the level of calcium and increasing the cardiac contractility. Next is what is the mechanism of action of the nitrates? This is the question. What are the antiemetic drugs? Different antiemetic drugs like diphenhydramine, ondansetron, promethazine, tetrahydrocannabinol, etc. What are the anti-ulcer drugs like proton pump inhibitors, local antacids, systemic antacids, sucralfate, prostaglandin analogs like misoprostol, etc. So these are the anti-ulcer drugs. Next question was that what is the major side effect of cimetidine? The major side effect of cimetidine is gynecomastia. It means increased breast size in males. So the next question that was being asked was what is the location of beta 1 and beta 2 receptors. The major location for the beta 1 and beta 2 receptors, beta 1 is present on the heart and kidney majorly, and beta 2 receptors are present in the eye, on the smooth muscle of the lungs, on the liver, on the uterus as well. So this is the location of these receptors. Next question is the anti-asthmatic drugs. Anti-asthmatic drugs like short-acting beta 2 agonists like salbutamol, etc. Then long-acting beta like formoterol, salmeterol drugs. Then methylxanthines, aminophylline, etc. Then corticosteroids. Then leukotriene, receptor blocker, leukotriene, production inhibitors, then monoclonal antibodies, etc. So these are the anti-asthmatic drugs. The next question that was what are the corticosteroids? Corticosteroids are a group of drugs, those for the treatment of the asthma and many of the other diseases. So in these class, the drugs are dexamethasone, fluticasone, like these drugs. So mechanism of action of these drugs is these drugs are going to inhibit enzyme responsible for production of like prostaglandins, leukotrienes, histamine, these chemical mediators. Okay, and the name of enzyme is phospholipase A2. Okay, so what are the sulfonylureas? Sulfonylureas are the drugs used for the treatment of diabetes, and the mechanism of action of these are the potassium channel blockers. By blocking the potassium channel in the beta cell of islets of the Langerhans, these are going to increase the level of insulin. So diuretics, what is the classification of the diuretics? There are four major categories of the diuretics. First is the carbonic anhydrase, then loop diuretics, then thiazides, then potassium sparing diuretics. Mechanism of action of ACE inhibitor, carbonic anhydrase are they going to inhibit the carbonic anhydrase. The loop diuretics are going to inhibit the sodium potassium 2-chloride co-transporter. Thiazide diuretics are going to block sodium chloride co-transporter, and spironolactone like potassium sparing diuretics are going to inhibit the aldosterone receptor. There are further sub-classification of these potassium sparing, like some are going to inhibit the aldosterone receptor and some are going to inhibit the sodium endothelial sodium channel. Okay, so there was the next question was antidiarrheal drugs, then antiemetics. What is the drugs used for the treatment of the glaucoma? There are different drugs used for the treatment of the glaucoma like pilocarpine, acetazolamide, ipaclonidine, prostaglandin analogs, then alpha-1 agonist, yes, for example, phenylephrine. So these are the major questions that can be asked in the viva regarding to secondary pharmacology. If you people like this video, please do me a favor, like, subscribe, and share. Thank you very much.